Welcome back to Wellbeing Wednesdays, brought to you by the Tulane University Counseling Center. I'm one of your co-hosts. I'm Shawna Foose. I am a staff therapist, and I'm joined, as always, by my lovely co-host.
Hello, everyone. I'm Dr. Jinaki, Flint, staff psychologist here at the Counseling Center. And today we are joined by two wonderful people. So if you would just please state your names and your roles.
Hi, my name is Quintella Cobb. You can call me Quinn. So if you see me, you can call me Quinn. I am one of the health promotion specialists at the Well for Health Promotion, and I focus on mental well-being programming.
Okay.
And
Welcome.
hello, my name, I'm so sorry. Caught up in our introduction there, Quinn. A little eager. Letitia Hinton here. I'm one of the assistant directors for the Well for Health Promotion in my previous role, but during COVID times, I'm now the interim director of Operation Auxiliary Services and the Tufts advisor.
Okay, welcome. Welcome, you guys. Thank you so much for coming today and joining us. We are so excited to have you. We have long enjoyed our relationship with the Well Health Promotion and seek to really deepen that as we move forward and hopefully put this pandemic behind us. Vaccinated.
Yes.
Right? So that, we can kind of be with each other, right? In real time. So yeah, so let's just jump right in, shall we? So, one of the reasons why we do some of this is to bring mental health education and awareness, but also to introduce our campus partners as well, so people can see in real time. We assume that people just know what we do, through osmosis somehow. But so this gives us an opportunity to kind of share with our campus community, what is it that we do in our roles at Tulane? So let's start with you, Quinn.
All right. So during my introduction, I said I do mental well-being programming. So to kind of break that down a bit, I focus on stress management and sleep hygiene mainly. And some of the things you may have seen because of COVID, it's a little tricky, but it's the 5 minutes of mindfulness video series that comes out every other Monday. I work with the Tufts to do that. As well as the Wearing Many Hats panel that happened a couple weeks back or last week. Time is funny. And I also work with our residential learning community, Health Wave. That is phasing out soon, but that is something I've been doing for the past year. Amongst other small things, but mainly my bubble is stress management, self-care, I would say, even though that's not particularly my focus area, but that's something I prioritize, and sleep hygiene.
Awesome. So 2 things I wanted to ask you. Tell us a little bit about you at Tulane and what question. That is designed to do for our campus community. I'm excited about that. I got to tell you about it later, but yes, please tell us and share with our campus community about this exciting new platform.
Yes, I forgot. Yes, You at Tulane is something that we worked to launch this semester, and I'm very happy about it. It is a personalized well-being portal, so it's supposed to help staff, student, and faculty with any of their well-being needs. The 3 domains are strive, thrive, and matter. So to help you with connections with other people, which is the matter part. Thrive, I believe, is your academic success and your, if it's not a student, then your career success, so helping you with professional development and giving you resources for that. It's mainly a hub of resources. And then also just your well-being, so mental, physical, there's a lot of mindfulness things that I've seen on there when I'm there by myself. But as well as any other resources, you might be oh, I need help with this, but I don't really know where to go. That's something that portal is definitely supposed to help you with. So financial aid, what else? Include trying to find your community. There's resources there too, for staff and for students. And faculty, of course. So it's supposed to be that main hub for where do I go? Who do I go to? What information can I get on XYZ topic, and they have Tulane resources as well as resources outside of Tulane. So I ran into a cute little mindfulness video. It was 2 minutes. It was very short, but it was a nice visual of someone playing with a board and had like water dye in it, and it was like super relaxing. And like, I know I didn't input that resource, but it was still very great. So there's a variety of resources on there that are meant to help you with your overall well-being, especially your mental well-being.
Wow.
Well, we certainly thank you for doing that, because that pulls together that community of care that we talk about, right?
Definitely.
So thank you for that, and that is amazing, an amazing feat, an amazing thing, and I'm looking forward to it growing exponentially and pulling us all together, because that really is a big deal, like trying to find resources and having them, all centrally located. So you just click a button, right? Because we all know we're living in this kind of click a button world.
Sure.
Right.
Can I jump in and give Quinn a little bit of a shout out? I don't think that most people maybe have been able to meet Quinn. She is one of our newest staff members. She joined during the pandemic. And so she has done all of this work while doing remote and sometimes not even meeting students in person, which I think is amazing. And she's also one of the few people that also implemented mental well-being activities for our students in COVID land. So while they were in isolation and quarantine, where that was an activity bag. And so I don't want to underplay what she's done, but she's done so many things that I don't think that she's even talking about all the things that she's had to learn as a new professional, as a new person to New Orleans and to Tulane, while also trying to do this job for mental well-being in such a crazy time, right? Like, when else would we also need to focus so much on this during a pandemic? And she's done an amazing job with all the different tools, from you to Tulane to the individual activities. So I just want to give you an extra shout out there, Quinn.
Thank you.
Yes.
Sometimes I definitely forget. So
shine on Quinn. Shine on Quinn. Yes.
That's what we're here for. It's some magic.
Absolutely. I'm glad you did that, Letitia, because she deserves it.
All of it. Yep.
Deserves it. Yes. And we're grateful for all of these, because it makes all of us run smoother, and so I just want to publicly give you thanks, and to back that up. Yes. Shout out for all that.
I couldn't do it without the support of Letitia and the rest of the team. So.
And so to the both of you, this next one goes to the both of you. I'd like to hear more about Tufts and what they do in our campus community. The Tulane is, you can tell me what the acronym is, Tulane University Peer Health Educator.
That
Am I right?
It. Yeah,
okay.
You're absolutely correct. So
yes.
They are called Tufts for short, and it is Tulane University Peer Health Educators. They've been around for a very long time and multiple iterations, and it has actually been a pleasure to work with them from when I was back in grad school. So I absolutely love this program with my dear heart. They are a group of very, very passionate individuals who want to help and wellness on campus, and that ranges from anything from mental well-being, like Quinn's focus area, to sexual violence prevention. And so the same topics that the welfare promotion staff, our health educators, health specialists cover, our peer educators can cover as well. The only difference, and actually the magic about it, is that they're students, right? Like, who wants to talk all the time to people who are not in their age group? Some of us are more in the age group, and that's cool, but why not use our students to be the ones to make the change on our campus? They can have those really trained conversations, or even just be, a network in the residence hall when someone is struggling. They have the resources. I think they're one of our most invaluable resources that we have a part of campus health, along with our other two student groups, SAFE and TIMS. But that's our main focus, is to do health and well-being in a variety of ways, which can be a workshop, it can be an event, an outreach event, even some educational programming that is required for first-year students, like orientation. So you name it, they can do it. And they've just been very well trained, and they work with other professional staff at the well, and actually within campus health in general, to do those things, to kind of be our little soldiers of information, if you will.
How many members do you have in Tufts these days?
Yeah, these days we've gone up and down. I think we're at 60 some. This is the first time in my entire career here that we've also had remote Tufts, which is like mind blowing. I didn't even know we could do it that way, but we can apparently. And so there's about 60. It has different levels. We have a leadership team. We do have an opportunity to pay them, so we call them Pay Tufts. And they do things like provide safer sex supplies in the residence hall. They put out the Stall Street journals all around campus, our posters. And then you have our volunteer Tufts. This upcoming semester, or last semester rather, during COVID, we took in 21 new members. And so I'm even excited about that. We did our new member education all virtual. You didn't know that was a possibility, but apparently you can do it. We had 2 classes that way. So it's been really amazing to work with those students.
Yeah. I can't wait to start working with you.
Yes, we got plenty. You let us know what you want to do.
Excited. I was like,
I'm going to shine a little light on you, Letitia, because I know that the Tufts organization has grown exponentially under your advisorship, and that you have been elected Advisor of the Year more than once, I think.
I have.
yeah.
Yeah. And
Yeah,
it's
thank
because
you.
of all the work and love and care you've put into that organization. So
Yeah,
props to
they
you.
make it easy. Thank you so
Yeah,
much.
shine on
I
Letitia.
appreciate it.
And just holding it down in general, Letitia.
Yes.
Like you know, you've really been a backbone and so you don't say enough about yourself.
Period.
But we will take this opportunity.
Okay, guys.
She's really amazing though.
You're accusing Quinn of it, but you're
Yes.
not either.
Hey, you know,
But
it makes
that
it easy
says
when
a
you work
lot
with
about,
great people like you all, you know?
But that
We're all
says a lot
student-centered.
about you guys as people in the work that you put into this, and because it's a labor of love. It's not,
It is.
you know, for the. I know it's not for the accolades, but I would be remiss if I didn't acknowledge how really you have been a strong supporter of us, and even like when I got here, like you were one of the first people to come to me and try to connect, and so I appreciate that.
No worries. Thank you
from,
so much.
From my heart. Yes. But you also mentioned another group that I'd like to hear more about, and I think our campus community may want to know more about, which are SAVES, right? So, when did they start? How many members are there? You know, and what is their role on campus?
Absolutely. I can give some of that information. As I'm not their primary advisor, and it has changed over time, but all of those organizations, Tufts, SAVES, and Tulane EMS, are all departmental organizations, which I think is really important to recognize. They're not recognized student orgs, so they don't get full funding from USG. They get it from our department, from Campus Health. But most importantly, they get to work directly with staff and be, I like to call it like a networking liaison relationship, which I think is amazing. I wish I would have had that when I was an undergrad. So if you kind of look at the 3 different tiers, it's kind of very much how we work. It's like our 3-legged chair, if you will. You have the prevention folks, right? You have the treatment folks, and you have the clinical side. So Tufts, in my opinion, is the public health prevention arm. You have SAFE that can actually dibble and dabble in a little bit of both, and also a lot of advocacy work when it comes to sexual violence and sexual health. They are the primary ones who run the 24-hour hotline for the sexual, so their acronym stands for Sexual Aggression Peer Education or Peer Hotline, but they're definitely still very much peer educators in a sense. And they do workshops, they do events. They're actually doing an event right now. Quinn could probably tell you way more than I am, but for SAM, for Sexual Assault Awareness Month. And I think what they're mostly known for is that hotline and the resources and the effort that comes into them being trained peers to have those deep conversations, sometimes very time-consuming crisis conversations with their peers about what may have happened to them or someone else, I think is really important. And then they advocate all over campus on how to make the world a better place when it comes to sexual violence prevention with our 2 other great immediate staff members, Jennifer Hunt and Chelsea Hill, who work under sexual violence prevention and sexual health. And they also put a spin on, they put a spin on sexual health. You know, like how do we talk about consent? How does sexual health and healthy relationships flow into sexual violence? I mean, there's just so many different layers that they can cover as well. And then you have EMS, right? And I think everyone knows them very well because it's easy to see their impact on our community. But I think sometimes the other 2 groups, it's a little, you see them everywhere, but you may not always know exactly what they do or how they do it. But our students mirror exactly our campus health image. They cover all 3 parts of the chair, which I think is amazing. For us, and they're just more soldiers, right? I think they have about the same amount of people as we do. I think overall we have over 100-something students involved with Campus Health because of those 3 organizations. So I think they're about 60 to 70 as well. So it's a lot of students.
That's pretty powerful to pull in peer educators. And it's so important because like you said earlier, you know, developmentally, they may really feel more comfortable and even safer talking to people that's closer to their own age group, right? Whereas, you know, I was just saying this in another meeting this morning that, you know, we don't know anything. We were never young once, but they're peers, right? And we love it, and we love to see it. So thank you for that. I want to turn some focus onto you. I want to keep it on you for a moment because I know you've been doing a lot of work around COVID-19. And I know that work it's got to be exhausting because there's been a lot happening on campuses. People have tried to adjust and trying to get tested. And so I was wondering if you could tell me a little bit about how that work is going. You know, we've had ebbs and flows on this campus. So whatever it is that you can tell our campus community about that would be appreciated too.
Absolutely. You know, I think that's exactly right. I think that the ebbs and flows have been interesting. We have all had to readjust and in many ways reclaim what does it mean for mental well-being professionally and personally. I joined kind of the COVID side of testing, surveillance testing, this into the semester as an interim role, but just help with contact tracing as well as many other fellow folks from Campus Health in the fall semester. And so I would say as a whole, I think that, you know, we are doing an excellent job as a community, really watching out for one another. I think we are embodying what it means to be a Tulanian with our mottos. And I continue folks to do that. I know the process has been confusing. It relies on a lot of technology, right? Like you didn't get your QR code or the portal. Sometimes it's only to make an appointment. But I think overall we're doing our part. And I think that's the best thing that we can all do, right? During these unconventional times. And so I think testing wise, folks are doing all that they can do. Vaccines is the new process of this role for me, having folks go to get their vaccination and uploading that information. And we're doing everything, not directly from Campus Health, but from working with other constituents. There's going to be like a vaccine, almost like a fest tonight, I believe, from 4 to 7, where folks were encouraging them to go get tested, and there will be food and things of that nature. And so I think as we do, when you're talking about public health work or just healthcare work in general, we're making the best out of the current situation that we've had. And I think that's really what, in light for me, the silver lining for COVID is going back to the fundamentals and the connection with people. We have reclaimed what it means for self-care and what it means to love one another and to be connected. And if that's the only thing we learned out of this over a year and a half, I think that is a powerful message. And I hope that we move into our new normal, continuing to use some of that self-care and mental well-being, being nice to each other, respecting each other, and caring for one another, whether that means getting a shot or a vaccine, I think is what I would continue for us to hope for us in the future.
That's beautiful. Yes, absolutely. That is just, I mean, if we could just do that.
Right, that's it. You know, if you learn nothing else about the COVID testing,
right.
Just go get tested. And if you'd like to, get your vaccine.
Exactly.
Not required, but all those things are available
right.
to you.
Right. You have resources.
You have resources. Absolutely.
Exactly. Okay. So as our newest staff member, Quinn, here, tell us a little bit about your vision for health promotion coming into kind of as we start to, and I'm going to name it and claim it, as we start to move this pandemic in our rear view. What are some of the things that maybe you're thinking about your department being on this campus?
Great question. So that's funny. I talked about this a little earlier today with people. And like when I first came to this position, I had like a list of ideas. And Letitia, the amazing supervisor she was like, what do you want to do? And I was like, oh, what do I want to do? And then, you know, of course, it hit some, walls with COVID. And so I'm very excited to just get some of the programs that just fit better in an in-person setting. And redoing some programs that I tried like this semester or last semester that might fit better in more of an in-person setting. I think in general, like health education and health promotion just hits harder when it's like someone next to you, especially when it's like, take care of yourself. Sometimes those messages are just repeated so many times that like it may just like become numb. But when it's somebody like in front of you, like I care about you and I want you to take care of yourself. And like, yes, academic success is important, but like I care about you, like as a human, from like human to human, like in person, like those conversations is what I'm looking forward to. I'm working on some workshops with some of my coworkers I'm super excited about. And I think if they're able to be in person, it would just really like, once again, like make it more of a human message. And we're definitely utilizing some of the Tufts for those workshops too, for it to be like peer-to-peer human like messages. Cause like we said, sometimes when you're older, it's like, yeah, you don't understand. But like just having those people who do understand to also repeat those messages. Yeah, there's a lot of random ideas. I'm super excited about, so like workshops and then like events that like may not directly be like education around health, but are still like promoting healthy behaviors and stuff like that, and those conversations.
Awesome. We are so looking forward to what you put on the table. I know it's going to be exciting. And hopefully I'll be a part of some of it.
Yes, definitely. I have like a whole sticky note pile, like, okay. Whole sticky note pile of like plans for next year. So, and your like counseling center is on them. So.
Hey, those Post-it notes become big things.
Yes. I have a lot of sticky notes in my house.
Right. So I know I've asked you a ton of questions because I'm just like going in. I love all the work you guys do. Is there anything that you would like for the community to know that you're doing that you feel that they don't know currently, or that they may need to know?
Nothing around what I'm doing now, but more of just like the general message that like the will for health promotion can sometimes be like overlooked or grouped together with campus health, but we really are unique in that I'm not saying that the rest of campus health is not, but I'm saying our staff.
I get that though.
We're really like a team who cares, and we do care about building connections with students. Because of COVID, it's a little bit harder to like find your way all the way up to the third floor, but in the future, definitely don't be shy to come out and like just talk to us, because we love humans. Like the one thing I can definitely say about our team, we're very like personal people, and we really do care. So if you ever need a conversation, and it may not be like a clinical conversation, but you just want a conversation about health, our team is definitely there to like connect with students as well as also educate them and promote different like health resources. So yeah, don't shy away from getting to know us as humans as well as.
Okay, and you guys could be found on the third floor
of the health center, yeah.
Of the Student Health Center, building 92.
Yes. The building numbers, I don't know. We collaborate with other departments too, so you might see us out and about and maybe don't know that.
And at an event coming near you.
Yeah.
And we also love collaboration. I think that's the other part. You know, if students or faculty or staff or other departments have ideas, feel free to connect with the well. We are happy to be innovators and creative with other folks. You got tons of event planners in the well that totally thrive off of doing those things. And so feel free, if you got an idea and you're not sure how to start it or how to complete it, we will be the folks that would love to do it with you. And all of our things are based on data. And so we do a lot of surveys and research, and we want it to be based off of the health initiatives or health things that are happening with our students, and making it most manageable for them. And that's why things change every 4 years, because some of our health issues, you know, stress is popular, but maybe it's COVID related or non-COVID related.
Yeah,
Definitely.
great.
And also we have like workshops and stuff that's just on our website. Feel free to, you know, if you have a student group or, you know, a group of people who may want a workshop on a certain topic, feel free to, you know, check out our website and request it or email us.
The Well Health Promotion Tulane, and it'll pop right up.
If you have an idea and you want it to come to life, like Letitia said, we're definitely.
But you have some workshop topics already available that a person could just request to have in their presentation or in their class.
Material. So you're RA, and you're like, oh, what do I want my bulletin board?
When you put in a lot of work in a short amount of time.
Yeah, for sure. I was going to mention, I love your 5 minutes of mindfulness.
Yeah.
I think those I watch them whenever they come out. So if you're not if our listeners are not following TU Campus Health,
Follow it.
And see them, and they're just wonderful little snippets of mindful practices, you know. And whenever I'm trying to promote mindfulness with students, I always remind them like a little bit goes a long way. And so
it does. It does. And what I love about it is that it's short. right? And because
Student.
one of my biggest pet peeves is how people pull people who don't even ask them if they have any skill in mindfulness, and then they try to make them do like 15 minutes of something. And and you're not really doing that if you don't really, do that. So it's just enough to get someone to stop and care for themselves for a little while, and then you can go on about your day, right? And they're really good too, so it's not like you're like feeling like you know
Yeah.
yeah.
The vision behind it was definitely that. We were hoping to get something short, sweet, and like, because sometimes like the excuse is always like, I don't have time for that, which is like also valid. Sometimes it's a reason, not an excuse, but it's like, I don't have time to like take care of myself. But it's like, you got 5 minutes. Like if you're on the toilet, if you walk in somewhere, like at the beginning, we're like, if you're taking a lunch, you have 5 minutes. And most of the time the videos are not a full length of 5 minutes.
Right.
So care for yourself.
Yes.
And
Yes.
also sometimes with mindfulness, it's like, oh, that's meditation, that's yoga. And so something I also wanted to work with the Tufts, like something me and the Tufts talked about, is having those activities not just be like meditation or deep breathing, like other things that sometimes isn't the first thing that comes through.
Because sometimes there's movement as well, right?
Mm-hmm.
Meditation is movement. There's an African saying that goes, if you want to meditate, move your feet. So it's a reminder that stillness is not the only way to be mindful.
Definitely. And sometimes that can be intimidating too, especially when it comes to meditation. Yes. Like, oh, I can't stand still. Like, oh no, I can't. Like, it's like uncomfortable, which is valid. We all have our different boundaries with our bodies.
Yeah.
Learning that,
sometimes the charge needs to happen. You need to discharge. So and movement allows that. So good, you are on it.
Students and those are Tufts, I assume, in the videos, who bring all that content. So once again, you're making sure it's student to student so that it's really relatable.
And the scriptwriter and the video editor are like two Tufts I've been working with since last semester. They're amazing.
Yes, this is a fully well-rounded program here. Yes, and kudos and congrats to you both. Welcome, and again, I am so excited and looking forward to all the stuff that you'll bring to the campus and being a part of it, because I love this stuff, and so I was excited to have you both on today, and you did not disappoint. Y'all are doing a lot.
I was bringing the content.
Wow, not that I thought you would, but I'm glad you did. And so thank you so much.
I'm going to share my screen really quickly here just to run through some reminders about the Counseling Center. If I can make it work. There it goes. Just want to remind everybody about how to find us at the Counseling Center. So if you're looking for any of our counseling staff on the Uptown campus, the clinic is in the Diebold Complex on the first floor, and that entrance is right across the street from the Riley Center. The clinic hours uptown are Monday through Thursday until 7 p.m. and on Fridays till 5. And we have a same-day appointment availability. So if you're interested in connecting with the Counseling Center for any of our services, like individual therapy or group therapy, your first appointment is a same-day consultation. So you call the number on your screen, 504-314-2277, and you'll be set up to meet with one of our staff that same day. You can talk about what your concerns might be, and the clinician you talk to will make some recommendations. And by the time you wrap up that appointment, you'll have a plan. And for many, many people, some relief comes just in that first step of making that plan for their support. Just a reminder that we have several groups. Most groups are underway and getting ready to wrap for the semester, but we always have groups. So if you're interested, you can come in anytime for that same day consultation appointment, and we can talk about groups. And if we're not able to get you into a group this semester, we can make plans for the next semester. That's all I have. It's been a pleasure to see you all. I wish it were in person. Maybe next time you're on, we'll do a live, real live, Wellbeing Wednesday recording, right?
Yes.
But yeah, the work you all do at the Well is unbelievable. We couldn't promote mental health and well-being without you. So it's just a pleasure to have you as colleagues.
Ditto that.
Yeah. So with that, yeah, thank you. Just a reminder, follow TU Campus Health on social media and on YouTube for new episodes of 5 Minutes of Mindfulness, for Wellbeing Wednesday, and all the great programming coming out of Campus Health. And with that, we will say goodbye and be well.
Bye.
Thank you.